Hello, everyone. We are starting live again. We were having some issues on the first one, so we're going to go live on this account. Don't worry, for those of you who missed the first part, I will let everyone know what the link was so that you didn't actually miss out. So don't worry, the information about healing or understanding what a toxic relationship is, you will get it, I promise. So without further ado, I would like to introduce you to Dr. Belle. Dr. Belle is going to talk to us about the association between trauma and our body. And I don't know about anybody here, but for when I was going through my abusive relationships, I had more difficulties with my body than I ever had at any other time in my life. I am 11 years older than I was, and I have none of those health problems at all. So if you are in that place where you're like, I have some weird health issues, I can't really figure out what's going on, it might be related to trauma that you have experienced at some point in your life or are currently experiencing now. So buckle up, come on, hang out with us. Remember to ask questions. If you're watching this as a replay, you can still ask questions. We will be going back and answering. But welcome, we're happy to have you, and welcome, Dr. Belle.
Thank you, thank you.
You're welcome.
I'm so happy to be here, and thank you so much, Stephanie, for kind of coordinating this whole event. I think everybody will get a lot of value out of it. So before I get started, I'd like to do a little bit of an exercise. And so if you could close your eyes. People online, if you're driving or operating any heavy machinery, please don't do it. So close your eyes if you feel comfortable with that. And I want you to put one hand on your chest and one hand on your stomach. And I just want you to focus on the rising and falling of your hands as you're breathing. Normal breathing, not trying to change anything, just normal breathing, just watching the rise and fall. And now I want you to shift that focus to the hand that's on your tummy. And I want you to breathe through your belly. So belly breathing. We all tend to be reactive to our environment, kind of having that chest breathing. And so I want you to shift that focus and see if you can breathe through your belly for just a few breaths. And so focusing on the rise and fall of your tummy, just for a few breaths. Good. Now you can open your eyes. So you just learned how to calm your nervous system down. I know it changed your life. I'm kidding. So really it was for my own selfish gain. The exercise kind of helps to kind of calm you down, helps to focus you, helps you to feel more centered. So for the rest of the talk today, you'll feel a little bit more grounded and concentrated during whatever the ladies are saying today. And so if you didn't know what you were doing, it's called diaphragmatic breathing. And so diaphragmatic breathing is a type of breathing that will engage your parasympathetic nervous system. And so parasympathetic nervous system is the rest and digest. And so it's the part of our nervous system that promotes recovery, it promotes relaxation, it helps our immune system, it helps with decreasing anxiety, decreasing pain. And so overall, just a lot of benefits with doing that exercise. And so what does that have to do with physical therapy? Well, I'll get to that a little bit later on in the talk. But first, I'd like to tell you a story. And so this was when I was a baby PT. I had just started in a neuro inpatient rehab unit. And so it was strokes, brain injury, spinal cord injury, if you don't know what that is. And there was a case that came in. It was a young lady. She was in her 30s, and she was a quadriplegic. So a quadriplegic is an injury to the upper levels of your spine, causing some loss of function in your arms and paralysis usually below that. And so as I was looking at her case, she didn't have an accident to damage her spine. She didn't have any trauma to her spinal cord. There was no virus that attacked her spinal cord. And so I was like, what is causing this paralysis in this lady? And so as I was reviewing her file, she had a history of child sexual abuse. And she had not seen her abuser in many years. And for one reason or another, her abuser came to see her. As soon as she saw him, she immediately became paralyzed, like literally paralyzed in that moment. And so she truly thought that she was paralyzed, and I worked with her for quite a while to get her back to recovery. So this particular disorder is called conversion disorder. And so what happens is you have this physical manifestation of something like seizures, blindness, paralysis, and it stems from something that is not neurologic in origin. So something like a mental health issue or a breakdown. And so it got me thinking, if somebody can have paralysis from trauma that they had before, just by looking at somebody, then what else can it cause? And as it turns out, a lot. And so my name is Belle. I'm a physical therapist. I've been a PT for about 10 years now, maybe a little bit more. And during that time, I've worked with a variety of patients from neuro, just like I said. I've worked with chronic pain, orthopedic, and also working most recently with pelvic floor. And so during that time, I've learned so much from all of my patients. So each one has given me a little bit of insight into their life, into their condition. And so I feel like it has helped me to shape how I approach my patients today. And I'm really grateful for that. So I want you to think about a time when you felt really scared or really, really angry. So all of that emotion in your body. And I want you to think about how your body felt, not what you were thinking. I want you to think about how your body felt. Maybe you're giving a speech and you're nervous, or you had some road rage on the way over here or something like that, right? And so I want you to think about what you were feeling in your body. And so let's take driving as an example. Say you're driving along and somebody slams on their brakes in front of you, and you slam on your brakes and you come like this close to hitting them. What are you feeling in that moment? What do you think? What are you feeling in your body? Maybe you hold your breath, right? Maybe you tense up. You get that weird feeling in your stomach, right? Yeah, your heart starts beating really fast. So all of that is a normal response of your sympathetic nervous system, or some people call it your fight or flight. And so that's a surge of hormones that's released to prepare our body for whatever threat is coming our way. And so it's normal. We get this response, this surge of hormones, and then we have a shake it off response. Nobody thinks about the shake it off response. And so after that event, we're usually shaking, right? Or we might start crying, or we might start laughing. That surge of energy that our body had needs to be released. And so that's what we do. Whatever we have learned to release that energy, we kind of shake it off, and then we move on with our day, right? Well, sometimes. So sometimes, let's say you're in that car, and sitting next to you is your toxic partner. You don't want to trigger them. You don't want to show that you're upset. Oh, this is embarrassing. I don't want them to see me cry. I don't want to make anybody upset. So you suppress that shake it off feeling, right? And you do that over and over and over. That's one way where we could kind of bury that stress in our bodies. So let's take another look at another situation. So let's say you're in a threatening situation, but you can't escape. You're stuck there. You can't get out of it. So she just talked about maybe one, right? So what are some situations where you might be stuck in a situation where you're in a constant state of threat?
A bad relationship.
That's right. We're here to talk about toxic relationships. And so if you're in a relationship where there's some abuse or whatever it may be, then your sympathetic nervous system is going to constantly be alert. And so you're going to be constantly shooting out those hormones. And we have this saying in the PT world that nerves that fire together, wire together. Your brain gets used to whatever you use the most as far as that path. And so if your sympathetic nervous system is the one that is always firing, that's the one that your body's going to get used to using, even after the relationship is over. So some people say, well, I don't know why I still have anxiety or I still feel this way. It's because your brain has learned that pattern of behavior. And so the sympathetic nervous system is fired up. And so most people think about PTSD, right? Or veterans, that's what most people think about when they think about PTSD. But there's also CPTSD, complex post-traumatic stress disorder. And that's when you suffer more than one event. So the event is happening over a long period of time. And so you build up all of these hormones in your body, the stress in your body. And so the complex post-traumatic stress issues tend to be a little bit worse. And so the way that you deal with trauma, you have to think about trauma. Trauma is never the actual event. It's how we respond to the event. And so if we have any issues with something really big going on, how are we going to approach that, right? And some of it has to deal with how big it is. Some of it has to deal with childhood, just like she was talking about. And so what kind of childhood did we have? Were we taught the tools to kind of help us recover from whatever situation? Did we feel safe in that environment? And sometimes you don't. They actually did a study. So there's a great book. If y'all have read it, you should read it. It's called The Body Keeps the Score. And so there's a study called the ACE study, Adverse Childhood Experiences. And so the ACE study conducted among like 17,000 people where they asked them 10 questions. And out of the 10 questions, it was like, was there any abuse in the household? Was there any neglect? Was there anybody that was living in the household that had a history of mental health issues or substance abuse issues, poverty, things like that? And so out of that, they said, well, how many of these people have suffered at least one adverse event? And so out of that 17,000 was about 62%, at least one. And I think 3 or more, it was a quarter. So the likelihood of somebody having some sort of adverse event is common. And this study in particular took into account the 17,000 was primarily white, middle class, higher than a high school education. So a different kind of demographic. They did another one called the Philadelphia study, where it was a more wider demographic. And the chance of somebody having at least one ACE was over 80%. And then the chance of them having 3 or 4 was 40%. And so again, the likelihood of somebody having some sort of adverse event during childhood is really high. And so what do all these numbers mean? So they followed these people in this study and tried to see what kind of conditions would they develop later on. And they found that people that had an ACE score of 4 or more, remember this like from 10, so 4 or more, 2 times more likely to smoke, 2.5 times more likely to have a sexually transmitted infection, 4 times more likely to have COPD, and 7 times more likely to consider themselves an alcoholic. The rate of suicide also increases exponentially as those ACE scores go up. So for an ACE score that's 4 or higher, the suicide rate goes from 0.7% with a 0 ACE score to over 17% with a 4 or more. And so they've also done studies for people that have suffered trauma. There's a higher incidence of diabetes, higher incidence of obesity, cancer, autoimmune disorders, so many things. So autoimmune is like MS, lupus, IBS, just to name a few. And so the implications of childhood events affecting us later in life is really, really high. And so it's not all in our heads. It's in our bodies too, right? And so what does that have to do with me, a physical therapist, right? And so I just want to take 2 conditions because mental health issues is also really high for people that have higher ACE scores, higher rates of depression and anxiety and things like that. So I want to talk about 2 of the most common mental health issues that people have. and what symptoms they tend to have. And so anxiety, what are some symptoms that you can think of that come with anxiety?
Racing heart.
Racing heart, yep. Maybe panic attacks, tension, right? Holding tension in their body. So they might have different aches and pains, feeling lightheaded, dizzy, right?
Trouble concentrating.
Abdominal issues, yep. Going to the bathroom more or less frequently. And so all of these are common with anxiety, but how many of those would they potentially come to see a physical therapist for, right? Jaw clenching, the muscle pain, the issues with going to the bathroom. They might come see a pelvic floor therapist for that. There's also like issues with intimacy that they might have that's related to anxiety, right? What about depression? What are some symptoms of depression that you can think of?
Lethargic.
Tired all the time, yeah. Hopelessness, maybe feeling really negative and irritable. Same thing, random aches and pains that tend to pop up without any really cause or anything like that. Losing interest in activities that you normally would like, sometimes being intimate with your partner as well. And so same thing, how many of those could they potentially see a physical therapist for, right? And so this isn't even a physical therapy diagnosis. This is just anxiety and depression. And so the chances of somebody having not only anxiety or depression, but also whatever they're coming to see you for. And so as a physical therapist, it's like we need to look at our patients in a different way. The typical PT model, we look at the body part, right? We look at the shoulder, the back, or the hip, or whatever it may be. Not really the psychology of what's going on with the patient. And I feel like we need to address whatever they're coming to see you for, but what other potential issues might they be dealing with in their life? So looking at them as a whole, stresses that they may be dealing with, and how is it affecting their pain and their recovery if it's some sort of injury, right? And so I'm not saying that physical therapists need to be a mental health therapist or anything like that, but to know the importance and the link between mental health issues and illness or pain, and see, okay, well, maybe that's a potential in my patient, and how can I address that? And how can we educate our patients so that they feel like they're more in control? So when I really started thinking about this when I started working with pelvic floor patients. I noticed working with my pelvic floor patients that a lot of them had a history of trauma. So we screened for that for pelvic floor because it is such a sensitive area. And I noticed that there was a really high percentage that had it. And it got me thinking, well, how common is this really? And they've looked into a bunch of studies between trauma and the pelvic floor. And so women with pelvic pain, about 50% have some history of physical or sexual abuse. And 1 in 3 has PTSD out of less than 10% nationwide. And so the chance that I'm encountering somebody that has some history of trauma, this isn't even taking into account that ACE study that I just talked about. This is abuse during their adult lives. And so what part of that is that, and what part of it is whatever they dealt with as children? And so I think it's really important to think about that when I approach my patients. And it made me look at my other patients differently also. My shoulder patients, my back patients. And so how much of their illness or pain, even my neurological patients, was related to some journey in their life that they've had that kind of led them on the path to illness or pain. And so what I like to do is when I'm with the patient is I think, what can I do? How can I better serve this patient without looking at them like you're a shoulder or you're a back or you're a hip? But what's going on with them as a whole? And how is it really affecting them? And so how I do this with my pelvic floor patients, so since we're talking about more of the toxic relationships and how to address that, the way that I look at my pelvic floor patients, if they're in a toxic relationship or maybe recovering from a toxic relationship. It depends. So it depends what they're coming to see me for. It depends what's bothering them, of course. But I think the main premise is I try to make them feel safe. You want them to feel safe in their bodies, especially if they've been through a toxic relationship. They're kind of in this constant cycle of that sympathetic response, right? And so what can I do to make them feel safe? And so we might start with some exercises just to allow them to feel safe in their bodies. Then we move on to exercises with a partner where they could feel safe with them without any pressure. It just kind of promotes communication and support with, I call it low stakes practice. Because there's no pressure to do anything. It's just how can I learn how to communicate and be safe in my body, but also be safe with the partner that I'm with. And so I also recommend things like yoga and breathing. That's why we did diaphragmatic breathing. And so how can we get this tension down in their body so that they can become more aware of just what's going on? It's so interesting to see how many patients don't really know what's going on in their bodies just because they've tried to ignore it for so long. And so I'm the one to teach them, okay, I see this, because as a physical therapist, if you've been doing it long enough, you know somebody's pain posture or pain expression. I call them silent screamers or the ones that just kind of tense up. They don't really say anything. And so you can read somebody and see if they have pain. And so you help them learn more about their bodies and what they're feeling so that they can move on to other things. And so I always recommend yoga. Yoga helps with that body awareness. Like I said, they're in that sympathetic state, or they may even be numb. Once you're in a relationship for so long, sometimes you become numb and you don't really feel anything. It's something that we learned to survive in that relationship, but it's not really serving you anymore. And so yoga helps with that. There's a lady that I love called the Pelvic Health Yogi that I recommend a lot of patients to. But that, along with breathing, along with therapy or coaching, like working with Miss Stephanie here, who's an expert with toxic relationships. So all of that combined will help with your path to recovery. And you can find yourself again so that you can feel a little bit more whole. And so what I was thinking about before this talk was it kind of comes at such a great time because Valentine's Day is next week, right? And so for people that celebrate Valentine's Day, you know, a bunch of couples get together, and it's usually a time of love, a time of intimacy, a time of connection. But for some people, it can be a time of stress, anxiety, and fear. And so just to know that you're not alone in this journey, and there are people that can help you. I focus on body movement. Of course, Miss Stephanie would help on your path to recovery as far as talking through things and finding your power again. And so I'd like to finish with just a quote. Always remember, you are braver than you believe, stronger than you seem, smarter than you think, and twice as beautiful as you imagined. Thank you. Any questions? No, let's see.
What would you recommend for jaw issues? Like, you know, I have, I wrote that Team J had for many years.
Mm-hmm.
And it was actually caused by car wreck.
Oh, okay.
So let's just say that I'm going down 249, it's going hitting from the side, I flew across the.
Oh my goodness.
I was 19 years old. So the car was sold that I had for last 4 years. But the idea is my jaw was not smashed. I wouldn't say smashed, it was bruised. And so when I got out, my face was all bruised, you know.
Yeah.
And they're like, oh, it'll, you know, if you get therapy, it'll get better. No. So I went to chiropractor where you did therapy, everything for like 5 years. So it didn't get better.
It's still the same?
It's still the same as it was 37 years ago. Yeah.
Mm-hmm.
Right now I had a tooth pulled on this side. So I chew on my right side, okay? And every time I chew on this side, it pops.
Okay.
It keeps going and on.
Yeah.
So then I go the other way, and if this tooth was in there, I'm gonna get it pretty soon, then I can chew on the left side. It's not too bad. But right now I have, I wouldn't say totally lockjaw, but I have a lockjaw on this side. That's why I have a hard time.
It catches.
Oh, yeah.
Yeah.
And then it's like, it's dead now. So I went to get an MRI done, and they told me to go have it fixed or whatever, because they're like, well, we found, the force, something wrong with it.
Mm-hmm.
So right now I've just been doing other stuff with it to make it, to where, it's better.
You wear a night guard or anything like that?
I've done all that. It does not help. I've done everything possible.
Yeah, it depends.
It's
It depends on
Yeah.
what they found, like on the MRI,
Right. Yeah.
and how much of it is off, right? So you can have some joint damage
Yeah.
to where it can be helped through physical therapy and things like that. But sometimes if there's really some damage to that
Right.
joint, then you have to see more of a
Yeah.
specialist
So
for
I'm
that.
supposed to go back soon and go figure out what they can do.
Yeah.
Because it's a special doctor that deals with, that for downtown. So the dentist really couldn't do a lot,
Mhm.
They're like, well, we can do this, the night guard and whatever, but that doesn't seem to be what's, the issue.
Yeah.
But I do a lot of exercise, with the dog. I'm gonna do a lot of stuff like that. The face massager,
Oh, that's good.
vibration,
There's so many
stuff,
muscles
and that does
around
help.
your mouth. Yeah, there's so many muscles around
Yeah.
your mouth, even ones deep in your neck that
Right.
could contribute to jaw pain. And so it's just figuring out which ones are really causing the dysfunction
Right.
and the pain. The popping may just be a hypermobility
And then
issue.
when I was, I guess it was 18, I was going down, like Highway 6,
Mhm.
and this girl's like right there, and she's like 19. I'm like, I know you're gonna hit me. I knew she was gonna hit me. I figured it out. So what happened is when I saw the mirror was she dropped her phone and hit me.
Oh
So,
my God.
I'm like freaking out, and she told me, no, I got my coffee. I'm like, so I went to the big old, it was a huge, Bronco, and I'm like, you're a liar. I didn't think of the court, but I got money out of her somehow. It took me 3 years to get money out of her because it was a COVID thing, COVID was going on. I'm like, just
Right.
give me the money and let's go, whatever. So I got money for the car, got money from her, but I didn't, I was like, I'm not sue her, but 'cause she was 19, but idiot. I was like, do you not get this? So I had major neck issues from that.
So it could be related.
Whiplash. So I'm thinking the issue now is the whiplash and, the jaw that.
Yep.
I've been seeing a chiropractor since then, off and on for like, 5 years or whatever.
Mhm.
And he helps me, but it doesn't solve the issue. So
Yeah.
maybe I need something else to, to
Or
do,
maybe
but-
retry physical therapy again
Yeah.
and go to like a TMJ specialist.
Yeah, that's what I was thinking about. Okay.
Because some therapists know a little bit about TMJ, but
Yeah.
not a whole lot. But if you go to a specialist, they are really good about going into each and every muscle, because there are a lot of muscles in your mouth
Okay.
and addressing each one. And so that's what I would do. I wouldn't go to just anyone. I would go to one that specializes in TMJ.
So I think
Because they'll even
Yeah.
look at your neck too.
Good.
So they handle like all of this.
The chiropractor, like pops your neck, and your back and
Yeah.
all that stuff. And you're maybe, okay for a couple of days. And then it comes right back.
Yeah, and that's what I always say. It's not really fixing what's
Right,
causing
it's
it,
not,
right?
yeah.
Right. It might
And
feel better in the moment, but it's not
Right.
fixing anything.
So I do a lot of, I've got this, the back massager with the heat,
Mm-hmm.
I do a lot of that. I've got a neck massager, people are like, wow, I have all the steps because it helps me feel better sleep,
Yeah. Yeah.
and the jaw issues too and all that. Otherwise, I'm like, not happy. So.
Yes, ma'am.
So here's my question. What got you interested in becoming a physical therapist? Were you like this little Belle and you're like, I'm gonna work one day to be a physical therapist? Or did something like call to you as you were growing up?
Both.
Awesome.
So when I was a little girl, I said I wanted to be a doctor or a teacher,
Nice.
and I'm kind of both. Right. And so, the physical therapy part, I really got interested a little bit later on because my dad had a stroke. He had a stroke when he was 45, very young. So we talked about how stress can cause a lot of issues. And so high blood pressure, that's what he had. The crazy thing is he just had another one from stress. And so really learning how to manage your stress is really important. But yeah, so I watched like the little bit of therapy that he had when he was going through it. And I was really drawn to it because we do spend more time with patients than really any other healthcare provider. And so developing that relationship and that rapport was what I really liked, because I started going to observe in clinics and things like that. And I think that's what I really liked, is you just develop that relationship with the patient or the client, and you learn more about what's going on with them. And I think as physical therapists, that's where we can really see, like, well, what else is going on? Yes, they have just this pain or that pain, but they're also going through a divorce or coming out of a really bad relationship, or they just lost their job. And so there's just like a lot of other things that could potentially be involved. And how can we be sensitive to that and help them on? I'm not saying that's all it's coming from, but it could be feeding into it. And they could have some relief just by trying to learn some ways to manage their stress. Yeah. Mm-hmm.
Okay. Okay. Sort of a chicken and egg question.
Sure.
Because if there's an emotional component to your physical pain,
Yeah.
do you have people resolve that first before coming back to you? Do you work with the therapist together? Do you try to help them get that emotional release before the physical release, or the physical effects? You know what I mean? Like,
I think it happens kind of all at
all
once.
together.
And so I think it is important to have somebody like Stephanie where they're working with somebody. But if you think about, like, for me personally, I didn't have the greatest childhood, but I don't remember most of it. So what happens when you repress? So you can't talk through or work through those emotions that you were feeling because you don't remember it, but it's still stored in here. And so I've worked with patients doing some types of somatic exercises, and they'll get a release and they will just start bawling, or their whole body will start shaking because all of that fight or flight that they've been holding inside is released in that moment. Yeah, it's so amazing to watch. And it's just like you see this relief after it's all over, and they're like, I don't know why I'm crying. And I'm like, just let it happen. And so just like I said, trying to be sensitive to their situation. And if you see, their shoulders are like this when they come to see you, you're like, well, they're probably having a little bit of stress, and see how we can just incorporate a little bit of stress reduction techniques into the treatment. It's like, it doesn't all have to be that. And not all patients that come to see me have any issues. It's just, you have to be sensitive to that. And if they're dealing with a lot of stress, how can I incorporate just a few things to allow them to feel safe in their bodies? And so, yeah, it's kind of both. Some people will think that they're not holding on to it. They'll be like, I've worked through that. Like this lady that had conversion disorder, she probably thought it's over. I haven't seen this guy in so many years. It's behind me. And then as soon as she sees him, she's paralyzed. And so you just never know how your body is going to respond to stress. Some people hold it in more. That would be me, because like I said, I don't remember a lot of it. And so the way that I handle my stress is very different compared to somebody who's just going to start bawling and become so emotional. I'm more of a shutdown kind of person. And so I think it depends on just how you manage it. Yeah.
Can you talk a little bit about how the pelvic floor issues can manifest themselves? I mean, I think about that as maybe urinary issues or
Yeah, I always get that.
function, but it sounds like you kind of mentioned something about stomach issues and stuff. I mean, are there symptoms that women might be having that might be related to pelvic floor
Absolutely.
issues that they don't recognize or
Yeah.
that?
So most people will ask me, they'll be like, you're a pelvic floor therapist. What is that? What do you do? And so, because it's not a common physical therapy thing. And so pelvic floor for physical therapists, we deal with incontinence. We deal with pelvic organ prolapse. It's men and women. So men would be like post-prostatectomy or chronic pelvic pain, maybe like Hershey's a doula, so pre and postpartum, that type of thing. And so if they're having like a lot of GI issues, and so they'll say like maybe they have incontinence and be like, I don't know what's going on. I just have to go all the time. And they don't realize that where they hold their tension is in their pelvic floor. And that tension pattern is presenting itself as, I have to go to the bathroom, because there's certain trigger points in your pelvic floor that can cause urgency. And so they'll be like, I don't know why I get urgency whenever I go here. Well, it's because those muscles are tightening up and it's causing you to feel like you have to go. And then pelvic pain too, it's just like, I have pain and I don't know why. And they might be holding a lot of their tension in their pelvis and they don't even realize it. And it's just getting them in tune with the tension holding patterns. And so I tell people all the time, tension goes where tension is. And so if you tend to hold tension somewhere in your body, then it's going to get a lot worse whenever you're encountering some sort of stressful event.
Second question, follow up to that.
Yeah.
If you have people that are sitting too much, that's probably causing more tension and stress than
It can.
the pelvic area.
Exactly. So it can cause more tension. It can cause more stress. And it can even cause some compression because you have some nerves there called the pudendal nerve and your sciatic nerve. So depending on how you shift your bottom, but those can be affected too, and those control bowel or bladder function. Yeah. So definitely. Anything else? I had a history of IBS and so any autoimmune disease, IBS, it's common with people that have a history of trauma, and that's not something that people think about, but it's something to consider. I'm not saying that all autoimmune diseases are stemmed from some trauma, but it's definitely something to think about whenever something pops up like that, and learning how to manage the stress that you hold, and have I really worked through everything, and how do I get my body a little bit more in control? I don't know how to do it.
I'm helping.
Exactly.
I was reading everyone's saying like how great of a presentation this was.
I think that's it.
Yeah. All right, awesome.
Thank you.
All right, thank you so much. All right, that was fabulous. I just need the mic. I'm sure everyone can hear me. All right, well, that was fabulous. I learned so much information, and I think that this is something that is getting more and more of a spotlight, is the effect of trauma on the body. I mean, I think that so often we go to the doctor and complain about certain ailments, but they don't really know how to help us, because it's not physically going on. Like it's the mental health part. We always put mental health on the back burner, like act as if mental health doesn't matter. Where there's a lot of taboo when it comes to mental health, but obviously it's affecting us in ways that we don't even realize it's affecting us. So excellent job. Thank you so much, Dr. Bell. And I would like to welcome another speaker who's going to be talking to you about the legal aspect. Now, this is something that I get a lot of questions about, and a lot of people that follow me, they get frustrated with lawyers. And I have a lot of lawyers. My sister's a lawyer. I love my lawyers. So I want to make sure that you see that this is the other side. So someone that's trying to help you through this divorce, there's a lot of things that are involved in it. And what I'm finding, what I really love about the next speaker, is that she is open to not only learning about what is going on with narcissism and things like that, but she also realizes that there's other things that play here when you're going through a divorce. So being able to have the right attorney for you is a really important part of the process in actually healing. So without further ado, I am going to welcome Teresa De Ford of De Ford Law. Welcome, and thank you so much for coming.
Thank you so much.
Yay.
Let me grab this little right here.
Woohoo!
Thank you. Hopefully you've all been listening to this entire presentation, because it's just a wealth, a wealth of information. And if you didn't catch Sheila's presentation, it was on a different live stream, please go back and watch that, because again, all of this information about recognizing toxic relationships, recognizing the physical, emotional, and physical aspects of it are so key. And by the time you get to me, if you get to me and you're seeking a divorce, you're thinking about divorce, then at that point, hopefully you've gathered some information about how it is affecting you. And like Stephanie said, any lawyer that you hire really should have knowledge about these issues, or at least be curious and know how all this affects you as an individual. Many times lawyers are looking out for the legal issue. They're getting you to the next step in the legal process, but but you're an individual, you're a person, you have a family. We really should be looking at how this affects you individually, how it affects your family, and helping you address it holistically and not just from a legal perspective. So I want to start out a little bit. Again, I'm Teresa De Ford from the De Ford Law Firm. We practice in the Woodlands, Texas, and handle divorce all around the Houston area. So Montgomery County, in Conroe, Texas, and in Houston and Harris County and surrounding areas. I have made it a mission of my firm to understand narcissistic behavior, to recognize that there's a lot of people out there that there's a lot of lawyers out there that think everybody that walks in the door will tell you that they're married to a narcissist. And honestly, that probably is true. A lot of people that do come to our offices believe they're married to narcissists. And I think most of the time it is true. Maybe not full-blown narcissism. Maybe there's personality disorders with narcissistic tendencies, but there's a lot of common elements. And recognizing that and knowing how to deal with those personality profiles goes a long way in making your divorce law smoother. So I did want to just say, everyone, I think, is susceptible. Sheila talked about this. Everyone is susceptible to toxic relationships in various different areas of our lives, whether it is from our parents, whether it's from siblings, whether it's in our romantic relationships, whether it's in our business relationships. I can tell you, as a lawyer practicing for 28 years now, law firms are some of the most toxic environments out there. And so, it wasn't until I started my own firm that I realized that I was holding a lot of tension and stress around how I managed my day and, guilt and fear about how I was doing things. I didn't allow myself to go run an errand after going to a hearing because I was worried I needed to get back to the office because somebody might be upset, but I was the boss and I still was worried about this. I have members of my team that will still say, Teresa, we love you, but we have PTSD from former bosses. So just bear with us, So anyways, again, it can happen in any area of life, and don't be ashamed if you find yourself in a toxic relationship. Just learn from it. Try to avoid, if you get out of it, try to avoid going back to it, and protect yourself. So I want to talk about more about the legal process, so that you have an idea of what that looks like if you get yourself into a toxic relationship or not, and are just ready to move on. And so what does it look like to leave this situation? I think before we get into that, I want to talk about the things that you can do to protect yourself before you get into a situation that makes it more difficult to get out of. And that is being independent, honestly, is really the most important thing. And Sheila talked about this a little bit earlier, talking about your daughters. And I love that. We should be teaching our daughters and our sons to be independent, not to be so attached to another person that you can't see straight, that you feel like your whole life is attached to them. And so that starts with, honestly, very simple, practical things like having your own income, having your ability to earn income, whether you have a degree or a license or just some training and skills that if I had to, I can go work and I can earn money for myself. And honestly, I truly believe that any woman, any man should have some independent source of income, whether you are staying home with the kids, you should have an ability to have your own income. You should have your own bank account. Yes. You may have tied family accounts and have joint accounts. Fine, not a problem. Have your own account. Have your own money. Have your own credit card. Even if it's a gas card, even if it's a Kohl's card or Dillard's card, Macy's, something that gives you a credit history. We see so many people that come to our office that money is a big thing when you decide to leave a marriage, and if your spouse is the sole breadwinner, now there's a lot of work that you have to do to prepare to get out of that. And it makes it much more difficult. If you have credit, it's helpful. You can use credit cards to hire lawyers, to hire therapists, to help you through this process. And having your own bank account. When you are not tied to that other person, when they are not controlling the purse strings 100%, makes a world of difference. And these are all true, not just in marriages, right? You know, we see a lot of people that are not getting married. They are living together. They are buying houses together. They are commingling their assets, buying cars together. Don't do that. Just don't. Come talk to a lawyer. I mean, you know, it's, you know, I think a lot of people, I've seen situations where maybe you plan to get married. And so, well, we'll buy a house together, but what if that doesn't work? And now there are a lot more protections, honestly, for married people when you divide up assets than there are for unmarried people. So just be careful, know what you're getting into there. And then, you know, access to friends and families. You know, Sheila also talked about the isolation. Make sure that you keep your relationships with friends and family. If you get isolated, if you get to that point where you have lost some of those relationships, start doing what you can to let people back in so that you have some individual support. And then, you know, in all situations, whether you're married, whether you're just in a committed relationship that doesn't involve a legal process, know your financial situation if you can. Know what your assets are. Know in general. I mean, not everybody's. I don't know exactly what my bank account is today, but just know in general where you bank, what kinds of retirement you may have, what your spouse may have.
Passwords.
Know the passwords to the bank account. Yes. I also do estate planning and probate, which is, you know, helps people transfer assets when someone has passed. And I had a very good friend several years ago whose husband died unexpectedly. And he did all the banking because he wanted to and was good at it. And she wasn't interested in it. Nobody was not a controlling relationship at all. It was just that's how they managed their life. And she didn't know where they banked. She didn't know the bank, how to get into the computer or the bank passwords. And it was a disaster when he passed unexpectedly for many reasons, but that, the financial part of that, just, you're already stressed, you've lost your spouse, and now you don't know anything about where anything is or how to get access to it. So, these are good tips for, again, that independence, knowing how to protect yourself and your kids. If something happens to your spouse, you need to know how to protect your kids and be able to get to the money. Don't let anyone else take over for you in those aspects, because we never know what the future is going to hold. So you need to be protecting yourself. So let's talk about, preparing to leave. When you have found yourself in a toxic relationship that you recognize that it is time to get out of. I would certainly recommend that the first thing you do is go talk to a lawyer, just to get information about your situation, how the law applies to you specifically. I'm looking at my glasses and I look like I've got a little glare or something going. Do you guys see it? I may have to. I can't take it off. I can't see. So go talk to a lawyer. Go to a seminar. We offer seminars for women in particular. There are other seminars in the Houston area for divorce. There's online webinars and such. Go find out information about, but talk to a legal professional about your situation, because everyone's situation is different. We, recognize that in most, in toxic relationships, not only is there the financial situation, but there's also the emotional part of, and often fear about what's going to happen if I leave the house. What happens to my rights to that house? What happens to my kids? What if my spouse blows a gasket? And what does that mean for me? So we really try to address that, each person individually. Get to know your significant other, get to find out what their triggers are, how we might approach leaving, and make a plan. And it's not just the legal plan. I mean, we can talk through that. We'll talk a little bit about what that looks like, but it's the simple things like if you didn't have a credit card, getting one, Did you know that you can apply for credit in your name, and you use the family income because Texas is a community property state? It's half your income anyway. So use the family income, go apply for a credit card if you don't have one, or if you don't have enough. Have it maybe sent to a different address, send it to your mom's house, your sister's house, so that your spouse does not know that it's there. And then you can start using that for the resources that you need if you need to go get an apartment, if you need to hire a lawyer. Things like stashing some cash away in either your own bank account or with a friend. I've seen women in particular, when they go to the grocery store, buy gift cards. The bank transaction will show that you went to Kroger and you spent $200 on groceries. If you pull cash, if you do a cash withdrawal, that's going to show up. But if you buy a gift card, that does not show up in the bank transaction. So do that, start gathering that information, or gathering those financial resources for yourself. And again, just get advice. Not a bad idea to talk to a financial advisor as well in these situations. If you have a financial advisor, probably best to maybe go talk with somebody else. If that is the family financial advisor, go talk to another one who can give you some ideas on budgeting, credit repair, those sorts of things that will be very helpful to you. So when you come to a lawyer and talk about leaving, one of the first things that they're going to ask you is how do you think your spouse is going to respond to this? How, do they know that you're thinking about leaving? Is it something you've discussed? If you don't know how they're going to respond, you want to talk with your lawyer about the best way. If you've decided that divorce is the answer and this is what you're going to do, you're moving forward with this, what is the best way to let your spouse know about this? Because unfortunately, we can't get divorced in private, can't do it in secret. They're going to have to know at some point, but you can do it in a way that is what I like to say, kinder and gentler, and maybe avoid the triggers, maybe avoid the big blow up. Sometimes that's going to happen anyways, and so we have to be prepared for that and have a backup plan. So when you get divorced, again, you can't do it in secret. The other person has to know. So there's a couple of different ways that they become aware that you have filed for divorce. One is just like you see on TV, you see a process server, constable, or a cop that walks up and hands you some papers and says, "You've been served." That's the TV version. And that's a legitimate legal way to do that. It is the formal, official way to do it. But it often causes a lot of problems when you're in a toxic relationship. It is the first thing, when you embarrass that person, when it becomes public, because if you've done it to them at work or at home in front of the kids or anyone else, that is much more likely to cause a big blow up than if you do it in a kinder, gentler way, which is to present it to them, either from your lawyer, through an email, through yourself. You can provide it to them. Obviously, you want to do that in a safe environment where you either have other people around, maybe you do it in a public place, and you sit them down and say, "Here's some papers. I've talked to a lawyer. I have decided to file for a divorce. I want to keep this amicable." And, the best way for us to do that is for you to either go take these to a lawyer and file a response, or here's something called a waiver of service. I don't want to embarrass you. I don't want to make this difficult, but do that in a way that protects yourself. But again, it's a great way to avoid poking the bear and causing that drama. Again, can't necessarily predict that they're not going to have a big blow up, but you can mitigate that in many situations. Some of the things that you should be working on when you are preparing to file for divorce, ideally before, but certainly when you're starting to talk with the lawyers, figuring out what does it look like, where are you going to live? Are you going to stay in your house, your apartment? Are you going to leave? Are you going to go to a friend or family member's house? Do you think they'll leave? Maybe you're already living separate, and so that would be ideal. That's helpful so that you don't have to worry about those things. But know that if you are a married couple in the state of Texas, you own a home or you rent, If your names are both on that lease, they're certainly, both going to be on the house, or you own it, it's a piece of community property. You can't necessarily force the other person to leave. And with toxic relationships, that's a really difficult situation, because now they know you want a divorce. You filed, they're aware of this, and you have to live together, at least for a while, because you can't make them leave unless there is family violence. There's already been family violence, then there's something that you can ask for a protective order. You can ask for something called a kick-out order, and they can be forced to leave. But those are difficult situations. Unfortunately, our courts don't necessarily look at the emotional abuse, the gaslighting, the general narcissistic tendencies as abuse such that they would allow somebody to be kicked out of a house. So it's a very difficult situation. So I often advise my clients that if you know that they're not going to leave and you don't have a place to go, we want to be very, very careful about how we manage that situation and have a plan. There is an option for, at some point, getting them out of the house, or certainly requesting that they leave or that you be allowed to leave. Sometimes financially, that's not possible for either one of you to go. And so there's different ways that you can manage that to be protected. But it's definitely something that you just don't want to do and just go file for divorce and have them served and then be living in that same house with no plan. You have to protect yourself. You have to protect your kids. That this is probably, that part of the process is probably the most dangerous for most people, is worrying about that. Now, like I said, there's kick-out orders, there's protective orders. If there has been physical violence, if there have been serious threats of physical violence, doesn't mean it has to have happened, but that they've been very much threatening. There's such a thing as a stalking order in Texas. So, if they are following you around either in person or electronically with air tags in your car or other tracking devices, or following you with your banking transactions, your phones, many people, their phones are being tracked. So if all of that is happening and there is, statements of, well, you don't know what's going to happen to you, that sort of thing, text messages, all of those can be used, that can help you obtain a protective order in a stalking order, even if there hasn't been a threat of family violence. So that is a threat of family violence, for lack of a better term. So again, some of the other things that you can do in preparing for divorce is to gather all of the financial documents that you can. This has become a little bit more difficult these days because so much is done by electronic, right? We all get our statements electronically, we pay bills electronically, so we're not always getting the mail. But if there is any paper in your house at all, and you have the ability to make copies of it, use your phone, take a picture of it, scan a picture of it, take it out of the house if you have to, scan it, bring it back so they don't know that it's gone. If there's any paper there, find it and take pictures of it. I work with a financial advisor, a certified divorce financial analyst, who tells the story that she had a woman that gathered documents in her house, and she's like, this guy keeps telling me we have no money, we have no assets. If I leave, I've got nothing. She brought a banker box to the financial advisor, and she went through it and dug through it, and she found several rental houses in California that they had, and $100,000 worth of CDs. So don't necessarily believe what they're telling you that you're broke. Trust but verify. Don't trust and verify. So she went through all of these documents, was able to find all these assets just from receipts that this lady found around the house. Just, if there is documentation, find it, take pictures of it. The more of that you can do ahead of time, it helps your lawyer identify places to go look. Maybe we don't have a full account statement, but we now know what bank that there might be assets at. And so those little things that can help your process can save you money. And it just, helps to avoid them hiding things that you may not know about. The other thing that I tell people is, again, because of the electronic situation, if you're not getting statements, when you do get a piece of mail, usually your W-2s come by mail. Take take a picture at least of the envelope. If there's a bank statement that comes once a year, again, take a picture of the envelope. Legally, I can't tell you to look at it because it's a federal offense to open somebody else's mail, but the outside of the envelope is fair game. The other thing you can do is, when they're not around, pull their wallet and pull out the cards and take pictures of all the cards. Again, it identifies what banks, what numbers, bank account numbers, credit card numbers. So the lawyer can go look for those assets and see what's there. Because I will tell you, in every toxic relationship that I've seen come through my doors, there is financial infidelity going on. I mean, there is hiding of assets, there is wasting of assets. Often there's either gambling or use of money on prostitutes and assets that we just didn't know were there. So any information that you can gather ahead of time is very, very helpful. So let's talk about once you get to the point of filing for divorce and they're now aware of that you're getting divorced, whether they've been served or whether you've told them. Now, what does it look like throughout that process when you are in a toxic relationship? Usually at this point, that person's going to double down. They're going to double down on their efforts to make you feel like you're crazy, make you feel like you're not going to get anything, tell you that they're going to take the kids and you're never going to see them again. And that is a very vulnerable state to be in. So again, you want to be talking with your lawyer. You definitely want to have a therapist at that point to help you work through to know what's true and what's not. I tell people all the time, let them talk, let them say what they're going to say, talk to the hand. I hear you. Thank you for that information. But try your best not to let it get to you because they are in fear. That is why they do what they do. They are afraid and they're going to project all of that on you and try to put you in fear. So even if you are afraid, even if all that they're saying is making you fearful, try not to let them see it and just listen and don't argue. We were talking about reactive abuse earlier. And, that is a very typical thing in a divorce situation where the toxic person will be at you, waiting for you to respond. And they're often videotaping you, or they have a recording device somewhere so that they know that the minute that you snap and react and hit them or scream at them or do something inappropriate in response to their abuse, that's what gets recorded and it makes it more difficult. So again, just be aware of those situations and try not to let yourself get into that point. It's funny, people are always very concerned about the recordings. I will have people come in and say, oh, my husband is recording everything I do. He's walking around with the phone and they're recording. He's putting it in my face and recording it. And of course, triggering me. Judges don't want to see those recordings. They really don't. They don't want to listen to them. People will bring in hours and hours of video and audio, and most of it a lot of times is not as bad as you think it is. I mean, at least not in a court's eyes, but that person is going to tell you, I've got you, I've got you on video, I've got you on audio, and you're in big trouble. Most of the time it's not nearly as bad as you think it is. But it is important, if you're going to record your spouse, make sure, don't do it in their face, put it in your pocket, keep it aside so that nobody's acting for the camera or the audio. So we're talking about, protecting yourself during that process to make sure that you are not overreacting, that you are trying to keep your emotions as calm as possible so that you, number one, can get through the process as quickly as possible without it dragging out for months, years. Thankfully, in Texas, most divorces are finalized at the outside within a year, and typically more like 6 to 9 months. But that's a long period of time for people going through this. And the more your emotions are out of control, the more you're listening to your toxic partner, and reacting to that, the harder it is to get to a resolution for yourself and your kids. So one of the big things that we see people reacting about and being fearful about is the situations with your kids, right? They're very important to us. I hear people talk all the time about, well, I don't want to lose my kids. I don't want that person to have my kids. I want sole custody. Well, truthfully, there's such a thing as sole custody. It's very rare. Unless your spouse has been convicted of being an axe murderer or is on crack cocaine or, serious issues, they're not losing their kids. No matter how difficult your relationship has been with them, if they are a safe person to be around your children, even if they may be emotionally abusive to you, even if they may be emotionally abusive to kids, they are still going to have the rights of a parent in Texas that any parent would have. That doesn't change. Again, unless they're a serious danger to your children, unless they've been convicted of a crime, they're going to be around. So this is somebody you're going to have to deal with as long as those kids are under your roof, and honestly, for the rest of their lives. I mean, you're going to have kids, you're going to have grandkids. You're likely going to be dealing with this person the rest of your life. You just have to manage what you can while your kids are under 18 and still in high school. So again, nobody's losing their kids. It's very unlikely that that anybody is not going to see them at all. Even axe murderers get to see their kids in jail. I mean, there's still visitation. So maybe supervised. Alcoholics still get to see their kids, but maybe they have to use a breathalyzer monitoring device. There's still going to be ways that they see them. And, same for you. I mean, it doesn't matter how bad a person you are, you are going to get to see your kids. And you're going to be involved in the decision-making for your children. So what is going to happen, though, is you're going to have a visitation schedule. And typically the kids are going to live primarily, is the word that we use, with one parent. And that determines where they go to school. So if you live in the Woodlands, Texas, and your kids go to Conroe ISD and they're zoned to the Woodlands High School, they're going to live with you, and they're going to go to those schools. That's really what being the primary parent is about. Usually that parent has them a little bit more of the time. It's not 70-30 or 70-30. It's not big differences really. But that parent who has the kids primarily is the one who's usually going to receive child support. So we see a lot of people coming in and say, well, my spouse says that we should do 50-50 custody and nobody pays the other one child support. Well, that sounds really great in theory, but if you were the stay-at-home parent and they were the breadwinner, now that means you get no money and you have equal access to the children.
Yeah.
Not exactly fair. So I tell my clients, don't let anybody tell you that you have to accept a 50-50 custody schedule if it means that you're not receiving child support. Now you can agree to that. That is something that many people do. It works for a lot of people, but it's not something you have to do because most judges will not order that. They will order what's called a standard possession schedule. And that standard possession schedule looks like it's pretty close to 50-50. It's like 47-53. And that can be adjusted by your particular situation. I like to say we don't do cookie cutter custom schedule. We don't do cookie cutter possession schedules, but the courts will. So if you walk into a court, they're going to give you the standard possession schedule. Usually, and ideally not because the moms are better, but usually the moms are going to be the primary parent unless dad has been, more actively involved. And, not to say that doesn't mean dad's a bad parent. It just means that in those situations, the moms have been more of the primary parent, the one that takes the kids to the doctor, the one that takes them to school, the one that takes them to their activities. And so that's the way it usually works out. And so they may have the 53% and dad has 47, but it's still pretty equal. The parent who has visitation is going to pay child support according to the guidelines of Texas. And what that looks like is that it's 20% of that person's gross income, but after taxes, not after your 401k deduction, not after the truck payment is pulled out, but after taxes. So they get a credit for their taxes. And also if they provide health insurance, then they also get a credit for the health insurance because that's also considered support. So it's 20% for one child, 25% for two children, 30% and on up to a certain level. And that is, it's standard. And so it doesn't matter if you make $50,000 a year and he makes $50,000 a year. Generally, that person, the person who has visitation is going to pay child support. And that comes back to the whole 50-50 thing. I mean, if you are not making anything and the other parent is making $100,000, then it doesn't make any sense for you not to receive any child support and for that person to get off scot-free. Now, if they're making $100,000 and you make $50,000 a year and you decide to do a 50-50 arrangement, it is possible that a judge may say, well, then we'll do an offset. We're going to look at this and say, we're going to calculate what child support would be for $100,000, calculate what it would be for $50,000, and the person who is making more is going to pay the offset of those two. So there's ways to do that fairly, and I was going to say equally, it's not equal, but there's ways to do that fairly in a way that accounts for the idea that we do 50-50. And if you're working with a reasonable person, I think they're usually going to be considerate and will consider that and perhaps agree to it. If not, then they go to court and you can have a regular possession schedule and they're going to pay child support according to the guidelines. So again, that is the big issue that we see most people dealing with is the custody aspects. That is more where my clients are fearful of losing their children, and the other parent is fearful as well. So if we can address that and make everyone comfortable about what that looks like and explain really what that possession schedule is and what it means, that it's not a big difference, that both parents are going to get to see their kids, that both parents still have rights to make decisions about their kids, then a lot of times that kind of diffuses that anger, it diffuses that fear, and we can move forward with that. Some things that to consider when you are making decisions about the rights and duties. There are some rights and duties that a court will ask you to assess for one parent or the other. I mean, these are big picture decisions, like, what kind of educational decisions are we going to make for our children? Are we going to have, if we have a special needs child, do they have an IEP or a special plan for them in their schooling? Are our kids going to take AP courses? From big picture medical decisions, if we've got a situation where our child needs medical attention that's going to involve surgical intervention, is that going to be an independent decision? Do either of you get to make the decision? Do you have to talk about it? Do you have to agree? Different situations, talking about it just means that I've told you what's going on and I'm going to go make the decision. I may have the independent right after consultation. And so I can tell you what's going on and then I get to go tell the doctor to go ahead. I talked to you about it. If you have to agree, then both parents have to agree. And when you have toxic relationships, often the toxic person is not going to agree just out of spite. They're not going to be necessarily looking out. First sick child. Yeah. It's because it's about them, right? Yeah. If they're a true narcissist, they're looking out for themselves, and how the world perceives them. And so sometimes you can use that guilt, that shame, and you can say, well, it looks really bad if you're not going to agree to this medical procedure for your child. But many times it's more of a way to get back at you. It is the control factor, absolutely. And so if they are going to withhold consent just to get back at you, that is something that we want to know in the process, because instead of then making these major decision-making factors joint such that you have to agree, we can say, well, we're gonna try to agree, but if we can't, we're gonna follow the recommendations of a professional. So in the situation of the medical, surgical intervention, we're gonna talk about this and try to agree. So everybody looks like you're being really, really accommodating and trusting, and we're gonna try to agree, but that person's never gonna agree. But you make the child's pediatrician or the surgeon, the professional, what we like to call tiebreakers. They're not really a tiebreaker, but we'll say that we're going to follow that person's recommendation. Now, in most cases, you're the one that's picked the pediatrician or the doctor that they're seeing. You pick the dentist, you pick the counselor. And so if that's the case, then you're going to trust what they say, right? So as long as the other person isn't picking that. But most of the time, you're the person that's picked those doctors and vetted them, and you have trusted. So that takes that decision making out of their control, or at least it prevents them from keeping things at a standstill. That's a huge factor in being able to get things done without playing that game. Another thing to really think about and consider in your divorce process is, how are you going to communicate with the parent of your children for as long as they are still under your control, right? Because again, just because you're divorced doesn't mean this person's going away. They're still around. They still have decision making. They're still seeing your children on a regular basis. And there's still things we have to talk about. One other thing I wanted to say about possession schedules. The best thing you can do in a possession schedule is to set it up so that the other parent is picking up your children for their time from school, so that they're not coming to your house or where you're living. You don't have to have the interaction with them most of the time. In summer it gets a little different, or specifically set another location where it's public, where you feel comfortable that they're not showing up at your house. We see lots of times, especially during the divorce process, before it's all done, before, when people still own the house together, well, they'll just walk in the house, it's my house too. And it gets really, really uncomfortable. So I think it's much better if you can do child exchanges at school or other locations. It just takes the steam out of it. But getting back to communication, there are a lot of great resources for people to use for communication, either while you're going through the divorce or after the divorce. Things like Our Family Wizard. There's one called Talking Parents. There's another one called App Close. And these are ways that you want to have it written into your order so that after the divorce is final, that any communication is required to be done through these apps. And that way you can exchange schedules. You can communicate about doctor's appointments. You can say, I took the child to the doctor today and the doctor recommends XYZ. Do you agree? Get it all in writing, any responses. If you are exchanging weekends, get that in writing. Any communication can be done through this app. The beauty of it is that if you ever need to go back to court down the road, and unfortunately, when you have toxic relationships, often we see these people going back to court over and over again to either modify their relationships or have to enforce agreements. And so everything that's in those apps can be used by a court without the rules of evidence. So you don't have to jump through any special hoops to get that information to evidence. The judge can pull up Our Family Wizard and read everything there. And that can be a gold mine of information. You see a lot of gaslighting in Our Family Wizard. Sure. The other great thing. Yes. The other really wonderful thing about Our Family Wizard in particular, I'm not sure if the other ones have it, but there's something called a tone meter. So as you're writing a message to your ex, it will send off an alert if it thinks that you're being too aggressive. Maybe you are being, this might trigger something, ding, ding, ding. Right. So it will say, maybe you might want to reword that. And so it's actually a very good tool because sometimes we get triggered ourselves and in that reactive space. It's easy to send a message that maybe you should have thought twice about. So our family wizard will give you that alert and let you know that, you may still send it, but at least you knew. So anyways, it's just a good place to keep information. I see a lot of times where, a narcissist will say, yeah, I'm going to follow that. I'm going to put all of my messages in there, and then they'll text you all the time. And that's where the really nasty stuff is going on, right? So I tell my clients,
Are screenshots still permissible?
absolutely,
Okay.
screenshot every text message and upload it to Our Family Wizard or whichever app you're using so that you have kept a record. Then, you think you're going around the rules, but pull it right back in there. So again, the courts can look at all of that. So that is just really important information to try to help manage the process. And, it takes a while to get to the point where where you're not being reactive, where you are able to use some of these tools and be objective about the process. And it may not be by the time the divorce is over. I think, it can take a long time and sometimes it's never over. It's for some people, it's hard to really pull themselves out of the thinking that they were in while in that relationship. But a lot of these tools can be really helpful. And again, using professionals, who can be objective about your situation, help you make a plan and prepare to get through it as easy as possible. So again, use your lawyers, find one who understands toxic relationships and what you're going through and how to help you address it, and maybe get, if you haven't found a counselor or a coach, the physical help that you need, use your lawyer to get you those resources, as well as financial people. We can be a great resource to get you connected with the right people so that you have a team of experts helping you through the process and helping you be objective, helping you see what you can't see. Because again, you've been in this toxic relationship. It's very hard to break out of that. It's going to take time. And so trust those people to help you do what's best for you. So, any questions?
Yeah. I know. Okay, can you talk about the difference between, because you brought this up a couple times, and I think it's useful for people to hear, the difference between a true narcissist and just a toxic individual, because there is a difference.
Yeah.
And I think people don't realize it. I think narcissism has become sort of
a buzzword. Yeah, it has.
And it's really not that every toxic person is a narcissist. There is a distinction.
Absolutely.
Narcissist is a clinical diagnosis.
Right.
So are you able to talk a little bit about that?
Yeah, I mean, I will say that, yes, I think, that term is used sort of as a lump of all the different personality disorders. And there are aspects things that narcissists do that other people that have, toxic personalities also do, but it's not full-blown narcissism. I'm not a therapist, so I can't specifically say, but I think, in the legal process, you have to be careful, if you're going in front of a judge and identifying somebody as a narcissist that hasn't been clinically diagnosed. I mean, you can talk about the behavior. I think that's probably more productive if you are trying to make a point to a judge about, why things should be a certain way, why what you're asking for is the best result, and use the behavior without labeling it, I think is probably the best way to handle that. And honestly, I mean, the court systems are just I think most judges recognize that personality disorders exist and that narcissism exists, and that these things affect the divorce process, but I don't think that the courts really know how best to handle that outside of any physical manifestations of those relationships. So, they will help protect you if from a behavioral standpoint, they see certain actions that are destructive and damaging to children. They will protect you if there is, like, for instance, some of the stalking and stuff, they will put orders in place to help protect against that if you ask for it. But they can't make that person be a different person. I think, and you know, that's probably the biggest issue that people deal with. You know, they think once I'm divorced, you know, I can now make that person be a better person or better parent, and that's not going to happen. You know, you're never going to change that person. And so you have to, I think, you know, for most people getting divorced, they have to get comfortable with the idea that you can't change them. Every behavior that they have had while you've been together, while you've been going through the divorce, is going to continue. You have to manage how you respond to that. So,
Okay, part 2 of my question.
Yeah.
What rights do children have? Because like if you have a teenager, for example, I mean,
right.
I heard you know a lot about custody of little
Yeah,
kids and you have
yeah.
to switch it back and forth. But if you have a teenager who says, no, I don't want to go with
Yeah.
that parent,
Yeah.
or do the kids have a chance to testify in court?
Great
And
question.
do they have rights if they don't want to go with the parent, or maybe one parent is abusive and
Yeah.
the kids know it, you know, what right do they have?
Excellent question. So generally they don't testify in court. Generally, I'm not saying never, but generally they don't. Usually if there are serious issues where children, you know, teenagers in particular, don't want to go with the other parent, there's usually going to be an amicus attorney appointed. And that amicus attorney is appointed for the best interest of the children. And they're going to talk with the kids, and then they can report to the judge and say, here's what's going on. This is what's going on with the kids. They can make other recommendations. What we see in a lot of those situations is not that it's not always that a judge is going to say they don't ever have to go. I mean, you know, the rights of a parent are pretty sacrosanct. And so most judges are loath to completely cut off contact, but they may limit it. They may structure it in a way, especially if there has been a therapist involved that can say, yes, this is a problem. That parent is emotionally damaging to this child, and we need to control this environment. And so usually, sorry, I just drew a complete blank of the type of, there's a specific type of a reunification counselor is, so there's counselors that specialize in reunification of family relationships. And sometimes there is one parent that is causing the problem. You know, sometimes not the parent you would think, actually. So, you know, you've heard of parental alienation. And so sometimes one parent is identified as being the horrible one, and it's really the parent who's pointing the finger who is causing the problem. So that's called parental alienation. And so, and the kids are emotionally mature enough to tell the difference in many cases. And a lot of times people around them aren't either. They, you know, you believe that person's evil. And so a therapist can really get in and identify, is this really true what's happening? Do we have a problem where one parent is demonizing the other parent for no reason or for a reason to get back at them? And how do we manage that? So those reunification counselors are very helpful. But sometimes it's the kids themselves who have have identified, look, I think I don't want a relationship with this parent, and I don't want to go with them. It gets very difficult the older they are, because once they have the ability to drive and run, go away, I'm not going with you. And so it's legally a judge will say that the kid has to go, unless there have been restrictions put in place about visitation, or there's been that, maybe we only have phone calls or video calls or things like that, or it's only with a therapist. Unless those things have already been put in place, the kids kind of have to go. At least you have to put forth every effort to encourage them to go, or you can be the one that can be in trouble for it. So anyways, it's a little bit of both. It kind of depends on how extreme it is, and how serious the kid is about not going.
Yeah. Is that the case also if there's been, like, say, one parent has been accused of sexual abuse or child abuse towards?
Yeah, well,
Kids,
obviously,
basically.
no. I
No,
mean,
okay.
yeah, in those situations, if there's an obvious danger,
In a
yeah,
police report.
yeah, oh, absolutely, yeah. And usually in that situation, CPS would have been involved. They usually will have a family plan where where the parent who has been accused of such a thing has no contact with the kids except maybe through a formal counseling process. So, great question.
Is the age for child support still 18?
It is 18,
Okay.
unless they haven't graduated from high school. So whichever is later. So if they turn 18 in December of their senior year, that child support continues until they graduate from high school. If they turned, 18 later after graduating from school, it goes until they're 18.
Yeah.
I think there's just, it's not really a question, but somebody made a comment there that their ex is still stalking her after they've been divorced for 4 years. So yeah, I mean, it continues. If you've been in a toxic relationship, that they're still attached to you. Sometimes even if they've moved on and have another relationship, they're still going to be attacking you in many different ways. I mean, my only recommendation there is to, if you know that that's happening, if you have, if you can get evidence of that, whether they are, whether you see them going by your house and you have, Ring doorbell video, if they're showing up places where you are, if they're, watching and then they're sending you text messages saying, hey, I saw you here and there and there, calling you at all hours of the day and night, call the police, make a report, document everything that you can, and file for a stalking protective order. So.
Thank you. I need to shake it off.
You need to move around for a second.
Deep breath.
Get up, yeah. Some breathing, awesome.
Dancing helps you shake it off too.
Yes, all those good things. Not the second, but at some point. All right, well, so far we've had some really amazing speakers. Thank you for everybody who's been watching us. I've learned some stuff, and I think, when we get into this and we start learning more and more, we realize how common this is and how much people are dealing with all of this. So, really important to get the knowledge piece of it. So thank you. And again, if you didn't get to watch the entire live stream, make sure you go back, because there was a part 1, which was all about, different types of abuse and being in a cult. So it's not just romantic relationships. We talk about toxic relationships. It literally can be anywhere. So make sure you go and watch part 1 and then come back here and finish watching the rest of the speakers that are here as well. So on that note, I am going to give you my ending of the presentation. We're a little bit over, so I apologize, but there's, again, so much great information. We want to be able to answer all the questions that you have. So for those of you who don't know me, my name is Stephanie McPhail, and I do specialize in toxic relationship recovery. And the reason why I got so interested in doing this is because I was someone who was really good at choosing really shitty partners and trying to make it work. I don't know if that resonates for anyone at all watching live or in person. I always chose bad partners. I chose people that were not a fit for me, and then I would try everything that I could to make it work. And then I felt like there was something wrong with me for not being able to make it work. I thought that I was broken, that something in me was making them behave this way. And I remember thinking to myself in high school, like, all the guys I like don't like me. Why? What's wrong with me? Am I that unattractive? Am I just that? Again, something is wrong with me. And I had a first long-term boyfriend. My first long-term boyfriend started out amazing. We were best friends. We had a house at 21. All the friends would come to our house and party at our house. Things were great at that time. At 21, to have a house and be able to do whatever you want was a pretty amazing thing. And a few years into the relationship, his father got sick. And he changed his personality, and he became suddenly very controlling. He would disappear and became very aggressive towards me, trying to control me and everything else. And because it had started out so fun to begin with, I was like, oh, it's just because he's going through grief. He's going to go back to that person he was before. So I kept waiting for that time to happen. Is he finally going to turn into that person that he was, that we had so much fun with? And his father ended up passing away, and he completely left. Like, I didn't see him. And when I did, he would be very, very aggressive, like talking about, and trigger warning throughout my presentation, because there will be some stuff I will talk about that is going to be triggering for some people. But there were times where he would get mad at me, and there were literally holes around my body where he had punched holes around the wall around me instead of punching me. So he wasn't physically abusing me, as he would say. He was letting out his anger, and luckily he didn't hit me around me.
Yeah.
My dog would cry. My golden retriever was amazing. So this went on for a long time, and I kept thinking to myself, like, this is just that for now, it's not going to continue. And I kept again hoping that that person was going to come back. And one night, after a night where he was again had not come home, I'd gone out with my friends. He got home at about 3, 4 o'clock in the morning. I was in my pajamas sleeping, and he came in and pulled me out of bed and said, "You've been out sleeping around." I was the one in bed. And so he actually decided, he went through my phone, started calling people that I'd been in conversation with. One of them was someone that I worked with, and accused me of cheating with this work person that was a male. Called up one of my friends. She freaked out. She called the police. Smart, because I wouldn't have done it. He took the phone and threw it across the room. I had no way to call anybody. Now that was my phone. So police show up at my house, and I am mortified. This was the first time I'd ever had police in my house. I had many police after that at one point in my life, but the first time ever. So the police come in there, they get him to leave. You know, they don't arrest him. They just ask him to leave. He leaves, and one of the police officers was 27 years old at that point. So imagine, remember, I was 21 when I bought the house. That was years of me dealing with him trying to be the person that I was hoping he would be, instead of realizing he wasn't going to go back to that. So at that point at 27, when the police officer came in, he said, "It's never going to get any better. You're too young. Stop doing this." And for some reason, that was like, oh yeah, I shouldn't keep doing this. And so I listened to him. I finally decided to break it off with him. We owned a house together. I had put my name on his car. So we had all these associations together, even though we weren't married. So I learned the very hard way that even though we weren't married, I lost a lot of money. I had to pay him out over $100,000 because the housing market was so good when we were selling, I guess, where I had to buy him out. The housing market was so good that the house had gone up like $200,000. So I had to pay him out in order to stay. And I wanted to stay in my home. So I paid him out $100,000. Once he was gone, I thought, he stalked me. He did a bunch of these other things. But once he was finally gone, I was like, okay, I'm smart. I'm never going to do that again. I'm just going to make sure that I never fall into another relationship that's like that. So I right away start dating again, get right back into the scene. And at 28 years old, I meet this guy that we had known each other. He'd been to a lot of my parties. I knew him pretty well. And one of my friends said, "Don't date him. He's dangerous." And I was like, really? Do you like me? Like, why are you telling me this? Like, I didn't really believe them or want to believe it. So we started dating, and I saw some red flags. There were definitely some red flags. But I didn't realize there was some guilt that I had over leaving my ex when he was sad with the grief. That was subconscious. I didn't realize that was happening. And so when this new guy came in, and he was telling me all the things I wanted to say, he was charming, he was fun, he was all of these things that seemed really good. And I also had my biological clock ticking, where I was like, I want to have a family, I want to settle down, I want all these things. And I've never really truly experienced a fully healthy relationship. So maybe this is the best I can do. And so all of those red flags that I saw that were waving me out were waving me into this relationship. And all of the things that were coming up that were huge red flags, I ignored them. Like me saying to him, "I don't want you to move in before we get married because it makes me nervous and uncomfortable." And he said, "Well, we're going to be sharing assets anyway. Might as well move in. It'll be cheaper." So against my better judgment, I did what he wanted. Then when he asked me to marry him and I said yes, he actually, I wanted to get married on the beach. He wanted to get married at a fancy place called Lohika Castle in Long Island, which is where like the richest people, rich and famous, all get married. I didn't want to spend all that money. Guess who paid for that marriage? I paid for the fancy wedding. So all of these things were red flags. But again, I was like, I want to get married, I want to have children, and I want to be married to have children. And all of those things were coming up. And I had all this underlying stuff that I had not healed before I started that relationship. So little did I know it was following me into it. And then we finally got married. Now, I'm not going to get even into some of the red flags that were physical things beforehand, talking about reactionary abuse, where I lost my temper after he had left me on a train at 2 o'clock in the morning. But all these things that had happened beforehand, I should have seen those as the red flags to keep me away, but it didn't happen. So we get married. Lohika Castle, my family comes from Europe. My mom's from France, so I had family that came from Europe. I had family from all over the United States come, so they had flown in to come to Long Island to come and be at this wedding. His family was there. It was the most beautiful day, like perfect. Pictures were beautiful. Everything was perfect. I was so happy. And I thought, oh my gosh, all of those things, it was just stress. People say that it's difficult getting ready for a marriage. Maybe that's just what it was, and he'll get better later on. Things are going to be better because I'm not going to lose my temper like that anymore. And I'm going to keep him from being that like aggressive because he was already showing those signs. And when we get married, have a beautiful day, and it's time to go up to the honeymoon suite. I get up to the honeymoon suite, and I had this beautiful gown that was laced all the way in the back. And he drew the tub, filled it up with water, and he said, well, why don't you get in? So I put my foot in, and as I put my foot in, some water spilled out onto the marble floor. And you would think that I had done capital murder. He started yelling and screaming at me that I didn't care about anything or anybody because I had ruined the floor. And I said, sweetheart, it is a marble floor. It's okay. Look, there's even a place for the water to go. Like there's a plug. Like it's okay. Not a big deal. This is a fancy place. And his response was, just like typical Stephanie, not to ever give a crap about anything that I do. And then starts yelling and screaming at me. So I'm now naked, okay, because I was going to go in the tub. I am naked, and I have nowhere to go. He starts chasing me around the honeymoon suite. I'm hiding in different rooms. He's knocking on the door, telling me that he wished that he wanted to kill me, that it was the worst mistake of his life, getting married to me. And like all of that, throws the wedding band at me. And again, and of course, at any point I could have run out the door and like gotten help, but I'm naked. And I forgot this part. The reason why he got a better deal at this place was because he knew one of the managers at this place. So in my mind, I'm like, I'm naked. I just married this man. I don't know what to do. He knows the owner. I didn't want to embarrass him. So I was still thinking about him as I'm getting chased around and being, threatened my life. And so finally, this goes on for about 3 or 4 hours until he finally gets me into the honeymoon, like the main part, the main bedroom, and throws me on the 4-post bed and starts strangling me until I thought I was going to die. And I remember looking at him as he was doing it, and my arms started to go weak. And I thought, this man that I married is going to kill me. All those things that I knew were warning signs, I ignored. And here I am married to this man. My minister married me. All these things are going on in my mind until finally he stops strangling me and walks away. And he starts crying, and I curl up in a ball. And I'm like, what am I going to do? I just married this man. I had my family. I had all these things. So again, all of those beliefs that I had, all those fears and shame and embarrassment, what was I going to do? I can't tell them that this just happened. This is terrible. So he knows that. He knows that I'm going to not want to say anything. So he starts promising me the world. I promise it's never going to happen again. I was just so stressed and overwhelmed for the day. I promise, if this ever happens again, you can divorce me and I'm not going to give you a problem. I say yes. And of course, if that was the case, I wouldn't be up here because we would have lived happily ever after and that would have been it. But that never is the case. It took about 3 months for him to start showing his true self again. And during the rest of our time together, I was again strangled. I was spit on. I would be threatened. He would tell me that they would never find my body in the swamps of New Jersey. He would tell me that he was going to burn down the house. He would kill the dog. And then he would tell me that he would never hurt me. And he just said those things because he was angry. But you're saying those things. It doesn't matter if you just said them when you're angry. And like now on the other side, you're like, I could never imagine my now husband telling me those things just because he's angry. But you would start living in this place. And because I had never healed those other parts of me, I ended up in this place again. And this was the worst of any relationship I had ever had. And so I stayed, tried to make it work. I would throw him out. I would let him back in. We went to therapy. The therapist would take me to the side and be like, this is scary. And I'd be like, this is nothing compared to what I deal with. Like I was so used to what was happening. It's like I was numb to it. And so I did all these things. And finally one day he had quit his job because he wanted to go back to school full time. And I said, I will support you because that's the reason why he was so angry, right? It's because he didn't like his job. So of course you should go do those things. So I was working a second job. I was a teacher full time. And then, on the weekends, sometimes I would take extra classes or, if there was some kind of testing or whatever, I would take those jobs, extra jobs. And I'm here doing testing, the SATs or whatever. And all of a sudden I get a text message from my ex that says, hey, I just wanted you to know I quit my job. And he had been a waiter And I had been paying all of the bills. I was taking care of everything. So normally, like, they talk a lot about how the woman is the one who doesn't have the money. I was the one who had the money. I was the one who had the assets, but I was the one taking care of him. So he tells me he quits his job, and I think to myself, great, that's terrible, because I was hoping to get some money to pay some of the bills that we have. He was supposed to get like $500, I think, because it was going to be a really big day. And so I said to him, sweetheart, a text message, hey, sweetheart, do me a favor and please just go back and say you lost your temper and you'd like to get your job back. And his response was, and for anyone on listening right now, excuse me, but his response was just like typical cunt bitch Stephanie, not to support her husband. I looked at that text message. I looked around at the kids taking their tests, and I was like, F that, I'm not doing this anymore. So I messaged a friend and I said, hey, you know how a few weeks ago we talked about me staying at your house for a little bit? Is that offer still open? She said, yes. And I said, okay, give me 2 days and I'm going to come stay at your place. So I packed up my stuff with the fear that he might kill my dogs. He might burn down my house. I don't know what he's going to do, but he can't know where I am. And he needs to know that this time I'm serious, because every time I had taken him back, every time there was that dance of back and forth, and I said, this time I'm not going to fall back into it again. So I stayed at a friend's house about almost an hour away from work. So it made my commute pretty terrible, but I knew I was safe. I was in a place that I could be. He was living in my house that I owned and I paid for. He was living with my dogs, and I was staying at my friend's couch almost an hour away, but I was safe. You'd think that that would be it. I got a divorce. He was actually not that bad during the divorce, which I was very surprised at. But I found out later the reason why he wasn't that bad is because he was hoping he would get me back. So if I'm nice to her during the divorce, maybe she'll take me back. That was really what it was. And so I go through the divorce, same kind of thing. I'm free. I don't have to worry about any of this anymore. I am never going to do that again. And I found myself in new relationships with other people that were also treating me badly. And I got to a point where I had been ghosted from a guy that I had met when we had dated in 7th grade. We're now 35 years old or 36 years old. So it was a lot of time had passed. He ghosted me and I fell into a depression. Like, couldn't get out of bed, lost 30 pounds, like was sleeping 3 hours a night, like full on depression. I had never experienced a depression. Even with all the other things I'd had in my life, I had never experienced a depression before. And here I was in the depths of a depression. I got a blood clot. My grandmother passed away. I got a DWI. All things, by the way, you can get a DWI from sitting in your car and not driving, but it's intent to drive. I learned the hard way.
Wow.
But so all these, like literally all of those, like 6 weeks, all of these horrible things kept happening. And then I end up in the ER, just getting over pink eye, because just throw that in there too. I end up in the ER because I sprained my ankle. And I'm at work. So who do they call but my ex-husband, because he's still on my list of emergency contacts. And I get into the ER and I'm sitting in there and the doctor comes in and he comes in, my husband's there, and the doctor says to me, you've severely sprained your ankle. And I was like, great, what am I gonna do? Like, this is just another thing. And I heard this voice, clear as day, that said, you need to be your own knight in shining armor. Stop waiting for somebody else to come and save you and save yourself. And it's still like, I can hear the voice, I can feel it. And it was a life-changing thing of, hey, I've been thinking I had to do this on my own. I can't, because I keep ending up here and it keeps getting worse and worse and worse and worse. It's not because I'm not smart. I need to find people that know how to do this, because I don't. And I had to have that, I had to admit that. Is say, I can't do this. It has nothing to do with intelligence. It has all to do with my ability to differentiate what was healthy and what is not. And so in that moment, when I heard that voice, I made it a mission for me to figure out what it was that I was doing wrong, because I was the common denominator. Even though I was picking crappy people and they were not nice to me and they were abusive and all of those things, that doesn't take away what happened. I was the one that was the common denominator. So what could I do differently so as not to end up in this situation again? And I decided I was going to take action. And so I did everything. I changed people that I was friends with. I started figuring out who I was. And I learned the process of how to really heal so that I could never do that again. And so here's one of the things that I really think are important for people to know. And one of them is the phases that we go through. The phases that we go through when we are in these toxic relationships is, number one, we recognize that there's a problem. Hey, something's not right. He keeps talking to me badly. He's saying, rude things. He's not coming home. He's being secretive with his phone, whatever. We recognize there's an issue. And then most of us, like me, and probably most people that are, listening, is we get into research mode. If I research the information, because we're smart, right? So we're like, if I research, I cannot do those things anymore. And so I became an expert on narcissism, and sociopaths and psychopaths and borderline personality and like all of those things. Oh, I didn't even realize I didn't have it. Hopefully you can hear me. And so I became an expert in all of those things. And actually, wait a minute. I hope it's still. Oh, that's true. Yeah, that's probably harder for me. So I became an expert in all of these things. And I would give him the information and say, hey, this is what I learned. What can we do differently? And he would be like, yeah, no. I'm not changing. It's not my fault. You're the one who's codependent. And I was like, what are you talking about? But you do that research thinking if I can just figure out the solution, I can get out of this situation. But of course, that research part keeps us stuck way longer than we should. The next part is the addiction. So again, it's if I can just change, if I can just explain it, if I could, like my ex, I'm going to throw you out, I'm going to let you back in, and all of that addiction, I call it the dance, right? And so with any addiction, it takes about 9 times to actually stop that addiction of actually trying to stop things about 9 times. It took me probably about that many to finally end that back and forth, because we get so stuck into trying to prove that we didn't waste time. We want to prove that we made a better decision because we saw the possibility in that person instead of who they were. So like, oh, look at you, I had this final project of like, oh, look at what I did, and this is what it is. So there's all of those things, you get addicted to it. And again, shame, embarrassment, all those kinds of things get into there. The next phase is acceptance, is realizing, okay, this is what it is. There's nothing I can do about it. Now what am I going to do? And then the next part is getting the support and accountability. This is the piece that we must get to at some point, because if not, we are going to go through those other places and stay stuck there. I find most of my clients are stuck in the research and addiction phase. They're still trying to learn. They're ending they're having a divorce, they're ending the relationship, and they're still researching narcissism for months and months and months and months. That doesn't help you. That literally doesn't help you to heal. It keeps you stuck. It keeps you stuck focusing on the other person. And the longer you focus on the other person, you're not focusing on yourself to heal. So when you get stuck in those places, that actually makes it take longer for you to heal. And of course, with the support and accountability, that means get a therapist, get a coach, get a professional who can help you through it, because we need to admit that it has nothing to do with our intelligence. It has to do with the tools that we have. We don't have the tools. When we can admit that, we can get the right type of support. And the cool thing is that in any part of that, you can take action. The quicker you take action on getting that support and deciding, I'm never doing this again, you can go through the other phases a lot more quickly and not waste so much more time. Because most of us, it takes a long time to get there. It takes a bunch of times trying to do it to finally get there. So the sooner we say, hey, I don't know what I'm doing, help me, we can take action and actually start making something different. It was when I said to myself, I promised myself I'm never doing this again. That's when I finally made that shift. When you make it so that there's no other chance but you making this better, you have a better chance of actually following through with it, because you won't give up. You know that you have to do something different. Now, there are 6 steps that I found when I was going through my process that helped me to heal, and that actually helps my clients heal as well. And the first one is, again, identify how you got to this place. This is where the therapists are really great at. Let's look at, hey, when I was 6, this is what happened. I'm not very good at communicating. Maybe you've had this, maybe you had a great, I have people that come to me, I had a great childhood. My family was wonderful. Everyone talks so nicely to each other. And then you start talking to them and you're like, there were some things that we could figure out that maybe, I'm glad you felt so good about that, but there's still some things that we could work through here. So whether it's identifying that's the childhood, or maybe even your own insecurities growing up that kind of kept you into this place, kind of like me, where I was like, why can't I find someone? Why, what's going on? And I started settling for those relationships that I shouldn't have been settling for. So identify is number one. The next one, and actually Teresa talked about this before, is build a team. You must have a team in order to heal. The team is friendships. I had lost so many friendships, and I think Sheila mentioned this as well. I had lost so many friendships along the way. I realized I had no girlfriends. I had my boyfriend or my husband. I didn't have any other friends. I didn't have a support network. And my first husband would try everything to try to make a problem with my family. He would cause issues so that I wouldn't have my family. He was trying to keep me away. So we need to build that team. Find those other people, because I'm going to tell you that even when you do find an amazing, wonderful partner, you still need to have that team, because that partner is not everything to you. It should not. They should not be everything to you. You still need a life other than your partner. So making sure that you build a team is something that's really, really important. The next one, and this is my favorite, is the discovery phase. Discover who you are. Who are you without a relationship? One of the worst mistakes I see anybody make is they get a divorce, they end a relationship, and they go right back into dating. It is terrible. Do not do that. Zero recommend. Because when you do that, you've taken, like I did, all those negative things that you learned in those other relationships, those subconscious fears and all those things that you had that you don't even realize because you haven't processed. And now you're bringing them into the next relationship. And when people do that, it tends to be because they're feeling needy. I need to have a relationship. If I'm not in a relationship, I'm not good enough. So needy people attract narcissists. A narcissist wants to feel needed. So if you don't heal that neediness and you let go from the need to have a relationship, and you build that life that you're excited and happy to wake up to every day, where you have that energy and again, just the things about yourself, who you are, what you want, and you can go out and realize, hey, I don't like football. I'm not going to watch football. Hint, hint. Or, I like hiking, or I like to do, Reiki or whatever it is. And this, to be able to have those things that you love to do, whether or not you're in a relationship, is important for everyone to have, because you can't, and again, even if you're in a happy marriage, the kids will grow up. You get older, things happen. You need to have something outside of just that relationship. So you have to make sure that you have that as well. The next one is understanding yourself. What are my limiting beliefs? What are the things that I've told myself about what's possible for me? One of the things I would say to myself is, I'm too broken. Nobody wants me. All the good guys are taken. All of those things that we tell ourselves will keep us stuck in there. So when we know what they are, the cool thing is that we can actually choose differently. So I might have the idea in my head that pops up of, hey, you're not good enough. When I realize that that's a feeling that I have, that thought can come up, and then I could say, wait a minute, that's me not feeling good enough. Okay, is that real? Is that relevant? Does that help me? And then can I make a different decision for myself? So when you get to know yourself and you're understanding who you are, you can see openly, without trying to make yourself feel bad, like, hey, these are the things that I need to work on. And then you're able to understand yourself, and you can see yourself from a slightly different perspective. The next one is pursue. Make sure that you pursue learning about communication styles. Make sure that you know about boundaries, because boundaries are one of the biggest reasons why we got stuck in here to begin with. I literally didn't know what a boundary was until I was 35 years old. Like, you can actually say what you don't want and people should listen to you. Like, it was like mind blowing to me that was even a possibility. But boundaries are something that's really important. So going out and pursuing and reconnecting to your gut as you're doing that as well. Because I had every part of my body was telling me don't do those things, but I didn't trust myself and I ignored it because, hey, I want this end result, so I'm going to ignore all those things. And when you do that long enough, then you don't trust your ability to make different decisions for yourself. So you have to pursue the ability to increase your self-esteem, pursue the ability to trust your gut, reconnect yourself, which is so what actually Dr. Belle was saying. Yoga is my favorite thing because we get into head when we're in trauma. So we need to reconnect head and body. And yoga is a wonderful way of doing that. If you haven't done it yet, definitely recommend that. But making sure that you pursue. And then the next step is goal setting. which feels probably like, well, shouldn't that be maybe the first step? Well, first the goal setting in your head is really taking action on healing. But now that you've gone through all this work, who are you? What's the new thing that you want to do? And the cool thing is that like when clients come to us and they start working through all these different things and they're like, I didn't know I wanted to be a business owner, or I didn't know that my job really sucked. And it was like, it started out with it being this unhealthy romantic relationship, but I've got some terrible friends, or my family's difficult, or the job isn't paying me enough, or whatever those other things are. And now the new goal is, I had a client of mine that she was like, my job is not really paying me. I think that they are like gaslighting me and stuff. She went out and found a job paying her 3 times the amount of money.
Wow.
Yeah. We had a client of ours that came to us because she had a toxic relationship. We started going through the process and I'm like, you have a problem with alcohol. At first she was like, no, I don't. We went through the process. She's been 3 years sober. But because she was trying to cover it up. But her original thing was like, she was covering up her feeling not good enough and all that kind of stuff. So you got to start looking for achieving other goals, because I will tell you that you were not put on this planet to suffer and deal with toxic people. That is not what you were put here for. And you're taking away the possibility for the universe to know all the beautiful gifts that you have, because you're living in this place of survival. And when you're in survival mode, you are not living in thrive mode. So we've got to get living in that thrive mode. When you get to that place where you're like, I feel good, I feel supported, I feel like I have great friendships, and you reconnect to your body, then you realize that I was put here to do really great things. And you can take that energy to do all of those things, but you can't do it when you're drowning, And most of the people that I talk to are these real professional women. So they're like, I'm really successful in my job. And then all of a sudden they end this relationship and they're like, oh my God, I didn't even realize how I was flying with a lead weight attached to me and how much easier it is to do all the things I thought were so hard. It's so much easier. So I'm going to end it with 2 things. One is Taylor Swift. Taylor Swift, and I was just today, I was watching a TikTok or something like that, and I was reminded of, if you remember Taylor Swift, whether you like her or not, which I'm beginning to like her more and more, I'm not going to lie, but Taylor Swift had all of her albums were sold out from underneath her. And for those of you who don't know, that in the music industry, they can do that. There's a lot of cutthroat stuff that happens. So she was really upset about the fact that everything was sold out from her. Now, she could have done 2 things. She could have continued to be upset that she had this experience and they sold her music, that was her music, that she did, blood, sweat, and tears to create this. Or she could re-record them and do something better. And what did she do? We all know she did number 2. And here's what, and the reason why I bring up that story is because those things that happened to us already happened. We can't go back and change them, but we can take the information that we learned and we can use that to catapult us to the new place. We can decide to live there and say, I'm upset with my parents or my ex or the this or the that because they didn't treat me the way I wanted them to. And we can stay living there, or we can decide, you know what? I'm going to take that. I'm not going to live there. They don't have that power over me, and I'm going to do whatever it takes to create an amazing life. And it's possible. You just have to cut yourself off from being stuck looking at the other things that have done wrong and be able to move forward and actually go to the next best chapter of your life. So on that note, let me just say this to you again. And I always, no matter how long that you've experienced toxic relationships, no matter what you've experienced in your past, it is possible for you to change. You have to make that decision for yourself, because there's a whole wide world out there that is waiting for you to share your gift with them. And everybody is getting a disservice by you not doing that wonderful thing. And you are having a disservice by not doing that wonderful thing that you were put here to do. So thank you, everybody, for tuning in and hanging out. I appreciate it. Are there any questions before we end? Yes.
So in dealing with some patients that are in toxic relationships, they kind of get addicted to that because it's so familiar.
Mm-hmm.
And so breaking out of it can be too painful, even though they know it's healthy.
Mm-hmm.
And so how do you get them through that?
So one of the things, so my book, Being Loved Shouldn't Hurt, is literally about that exactly thing. So when you're used to, and actually my husband, David, and I didn't even mention, which is weird because I normally do, but now happily married, I have 2 beautiful children. And my husband, David, actually uses something called Psych-K. Psych-K helps with the subconscious beliefs that we have about something. So if we are so used to doing things a certain way, it feels weird to do it differently. I mean, even think about like when you cross your legs, you probably always cross the same leg over the other one. Just doing it the other way, you're like, that feels weird. Or like, like there's certain things that just feel weird. So we might say intellectually, I want to do something different, but like me, I kept repeating the same patterns over and over again. So, when I remember realizing that when I realized love was not supposed to be stressful and overwhelming and causing anxiety, and I instead realized that love was supposed to be calm and patient and safe. When I had that shift, things started to change. And when my husband, David, works with clients, he can actually help you sit down and discover what that thing is, that rut that you're in, that you keep going back to subconsciously, and help you change that subconscious belief. So if your belief is relationships are hard, it's not possible for me to change, I'm not good enough, all the good ones are taken, whatever, he can actually sit down with a client, and with the balance is what it's called, he can help you change that belief to now become something different, as in I am powerful, I am capable, whatever that it's like having an affirmation. But instead of it being like 6 months of affirmations, he can do it in 1 session. Yeah. So and this is what we're finding more and more with what we've been doing, is that subconscious belief work is becoming more and more popular, because you can tell your conscious thinking brain all the time, don't do those things, but we go into automatic pilot right away. So we have to change the subconscious, whether it's Psych-K. I've heard people, a lot of like therapists and stuff, you use EMDR and NLP, which are great, but they take 6 months to a year, and only about 50% or so of people notice a change. Again, with our clients, we use Psych-K because for some people it's 1 session and that's it. So, some people need a little bit more, but most of the time it's just 1. So what's another one? Now I'm trying to think what it is. Hypnotism. You can go to a hypnotist. That will work for some people as well.
Oral feedback too.
Yeah. So all of those things, find something that works for you. Again, we find that Psych-K works really well, but if there's something else that you want to try, you can go for that as well. But very important. Any other questions?
Can I ask how you met your husband after dating your wife? That's
So it's so funny. So we actually met online. And people are always like, really? Because all the good ones are taken. One of the things that when my clients get to the point where they're ready to start dating, I say to them, start getting a really clear idea of what it is that you want. I did. I really totally did. Even for the fact of like, I wanted someone who was 6'3", who was a musician, who wanted to be an entrepreneur, who wanted a family, who had no children yet. And we met, I was 37 when we met. And he's 39. I wanted someone about 2 to 3 years older than me. He was 39, I was 37. We're 2 years, 2 days, or 2 months and 2 days difference. So yeah, like it was like, oh my gosh, all these things. Now, when I first was in the dating, I was like, I want a guy with this color hair, blah, blah, blah. And then as I started dating, I was like, it's actually okay if they're bald. And it was literally when I decided it was okay if they were bald that I met my husband who's bald. And he had no kids. And so we have 2 beautiful children. So I heard you talk about being an older parent. My first was at 38 and my second was at 40. So anyone who says like, well, you're too old, all those things, you're not.
You're not too old.
You're not. And it was no problem with us getting pregnant. That's not the same for everybody, but it was no problem. And thank goodness that I did not have children with my ex, because
Oh my gosh, yeah.
Ours was he's diabetic, and that was always like, whatever. It's like calm down, chill out, and then there you go. So both of us decided that, the older you get, you're like, wow, when.
And I'm really glad I waited. Actually, my kid said something the other day about like, I don't remember. Maybe it wasn't something about my age, but it was something like that. And I was like, you are so lucky that you have your daddy.
Yeah.
You don't know what it would have been like. Like, I picked a good daddy for you. We're not a good daddy before. Any other questions? Let me see. I don't see any questions online, which is weird. Normally I see lots of questions. If you're online and you're watching, feel free to ask any questions. And of course, we will be watching this, or we will be going back and answering any questions, but is there any other questions?
What
Okay.
about your ex? Did he ever?
Well, I mean, I did used to live in New York and I now live in Texas. And I will tell you that was definitely a little extra bonus of me moving to Texas, to be completely frank, because, you know, I was still living in my old house. He would drive by. He knew where I was. And so that was something, you know, to know that we hung out in similar circles, things like that. So yeah, that was definitely part of it. And then the other thing was recently, well, he's had exes that have reached out to me and said, how dangerous is he?
Oh, wow.
And they joined my group and read my book. But then he would turn around and say, the only reason why they're saying these things is because they read your book. Like, you don't, again, no responsibility.
Yeah, right.
Like, not because you actually did those things that are terrible.
Yeah, you're crazy. I did it. Yeah.
You're crazy. No, so still to this day, I think his sister was like looking on our LinkedIn accounts only about a few months ago, and we've been divorced for 11 years.
Wow.
Yeah. And it was about, I think the last altercation was last year. He always said he's going to call a lawyer and get me sued because I'm like, I never say your name. I don't, you know, yeah, the book. I'm like, it's never, but it's not even about you. It's about my healing.
Yeah.
So, you know, I talk about those things, and, you know, I think it was about a year ago, he was like, we should do a Zoom call. And, you know, if you'd like, your husband can be on with me. And I'm like, why is he even, now he's blocked everywhere. So he finds ways sometimes to still reach out.
Yeah.
Covering.
Yeah. So yeah,
Wow.
Wow.
That's,
they don't like to stop. All right. Well, no other questions. You know, thank you everybody for coming in and hanging out with us during the event. We really appreciate it. And as always, we're actually going to be giving out some freebies. So I know that all of the speakers are just going to have stuff to share with all of you. So we will put that in any of those links in the comments. When I'm done, it's going to take me a little bit, but I will send some links to everybody who watched. And I think that's pretty much it. Make sure that the biggest thing that I hope anyone gets out of this is to just realize that there is help out there. We don't have to figure it out on our own. And if there's those little parts of us inside that are saying something is wrong, listen to it, because your gut is telling you and trying to help and save you. Start listening to where your heart is pulling you, and you can't go wrong. Stay away from the fear, go back to the heart. So on that note, thank you everybody for hanging out with us, tuning in, and never forget, you are way stronger than you realize. Bye everybody.